The Subcommittee on Environment will come to order. Good morning. Welcome to today's hearing entitled The State of the Environment, Evaluating Progress and Priorities. In front of you are the packets containing the written testimony, biographies, and truth and testimony disclosures for today's witness panels. I recognize myself for 5 minutes for an opening statement. Good morning. Welcome to the first hearing of the Environment Subcommittee in 2013. It's not only the first hearing in 2013, it's the first hearing of the Environment Subcommittee. As you know, the committee reorganization separated Energy and Environment Subcommittee into two, and this is the Environment Subcommittee. Our hearing today is entitled The State of the Environment, Evaluating Progress and Priorities. I first want to recognize and welcome our new ranking member, Representative Suzanne Bonamici from Oregon, as well as our new Vice Chairman, Chris Stewart from Utah. Of course, we all welcome the gentleman from Texas, Chairman of the Science, Space, and Technology Committee, Mr. Lamar Smith. I look forward to working all the members of the subcommittee on a myriad of environmental issues in the 113th Congress. Today we're going to talk about the greatest story never told. In the last 4 decades, Americans have witnessed dramatic improvements in the environmental health of this country. This is characterized by the improvement in air and water quality, less exposure to toxic chemicals, and growing forest areas, to name a few. All the while, the U.S. has experienced significant growth in GDP and per capita income. This progress is due to a number of factors, including technological innovations, state and local efforts, and to some degree, the rational implementation of federal regulations. Just 2 days ago would have been the 82nd birthday of Julian Simon, renowned economist from the University of Maryland. His most important insights were that the world is getting better all the time, and that energy serves as the, quote, master resource for those improvements. I couldn't agree more. My children are growing up in a much healthier world than the one where I grew up. However, despite the substantial progress made in environmental health and quality of life, Americans are constantly bombarded by the media and this administration with doomsday predictions. For instance, we've been told that extreme storms and increased childhood asthma are indicators that the environment is worse off than ever. These allegations fly in the face of the hard facts that severe weather has always been a threat and that our air quality has improved dramatically. These invented crises and the mentality around it prove what another fellow Marylander and columnist for the Baltimore Sun, H.L. Mencken, wrote, and I quote, "The whole aim of practical politics is to keep the populace alarmed, and hence clamorous to be led to safety, by menacing it with an endless series of hobgoblins, all of them imaginary." So what is the solution to this disconnect between reality and what we're being told? How do we work together on continuing to enhance environmental health without needlessly scaring our constituents or stifling our floundering economy? First, I believe we must recognize and educate people about the incredible progress made so far. Since 1980, aggregate emissions of the 6 criteria air pollutants regulated under the Clean Air Act have dropped 63%. Over a similar period, there's been a 65% reduction in toxic release of chemicals tracked by the EPA. Other indicators demonstrate a similar trend of reduced environmental risk. Second, we must acknowledge that most of the gains made in environmental health thus far were changes that were affordable, or if they had high costs, the associated benefits were clear, significant, and cost-effective. Future progress will not likely be so easily identified, will be extremely costly, and benefits may be unquantifiable. For example, the latest round of increasingly burdensome regulations may result in the closing of power plants, reducing manufacturing production, and sending American jobs overseas. We're already seeing employers react to proposed EPA regulations in this manner. What is not included in the government's analysis is the added cost of regulations to consumers, resulting higher energy and food bills, or the inevitable hardships that occur when companies are forced to reduce their workforce. Once these two tenets are accepted, that the environment is getting better and that even well-intended actions may harm the economy, we can begin to prioritize a research and development and regulatory agenda that actually protects human health and the environment without crippling the economy. In light of the President's pledge in this week's State of the Union that he will, quote, direct my cabinet to come up with executive actions we can take now and in the future to reduce pollution, it is critical that any such actions be based on good, transparent science, and not on imaginary hobgoblins. I look forward to hearing from our witnesses on how to balance quality science and need for regulation with true economic costs and benefits. Thank you. I now recognize the ranking member, the gentlewoman from Oregon, Ms. Bonamici, for an opening statement.
Thank you very much. Thank you. Thank you, Chairman Harris, for holding the subcommittee's first hearing on the state of our environment. This hearing marks an important opportunity to plan for the future, to set the tone for the new Congress in what I hope will be a collaborative effort to ensure our long-term economic vitality and to protect human health and our natural resources. It's a matter of common sense that we must coordinate research and technological innovation to enhance air and water quality to protect the health of our children and future generations. The 1st District of Oregon, which I represent, is a leader in this area, as it is in many fields. In fact, in June of last year, the U.S. Conference of Mayors gave Beaverton, Oregon, the Mayor's Climate Protection Award, and later that city received EPA's 2012 Leadership Award. The state of Oregon has additionally shown that it's committed to protecting human health by reducing harmful emissions, with a statewide goal of reducing greenhouse gas emissions to 10% below 1990 levels by 2020 and 75% below 1990 levels by 2050. I've read the testimony of the witnesses and their biographies, and I'm glad you've come to this committee. Both the majority witnesses have enjoyed long careers in the regulatory sector, and I understand from talking to environmental regulators at both the state and federal level that the process of implementing regulations can be both challenging and daunting work. With that said, this subcommittee and this hearing in particular should focus on the science that has led to successful EPA regulations that are acknowledged by all 3 witnesses, and those discoveries that are still unknown that may tell us more about how the pollution in our air and water is affecting our health. As technology changes and as our research methodology becomes more accurate, as industries change and new industries are created, as populations grow, new problems will continue to emerge. We will not have all the answers immediately, but as public servants, it is our responsibility to continue to investigate. More than 40 years ago, Congress passed several pieces of landmark legislation to protect our environment: the National Environmental Policy Act, the Clean Air Act, and the Clean Water Act. All of these laws passed with bipartisan support. In 1970, it was President Nixon who's credited with creating the Environmental Protection Agency, and the EPA became the lead federal agency with responsibility for implementing these laws, and today works in collaboration with other federal and state agencies to protect human health and environment. Today, we'll hear from our panelists and subcommittee members on the costs and benefits of environmental protection. Although there may be serious questions on which we disagree, we can all agree that our air and water is cleaner than it was 40 years ago before the Clean Air and Clean Water Acts became law. But our work is not done. As we look ahead to future EPA actions, including the issuance of new and updated regulations, it's worth reminding ourselves of the source of such regulation and the benefit to society. In that regard, the Clean Air Act's history of protecting public health speaks for itself. In the 4 decades since it was signed, the Clean Air Act has prevented hundreds of thousands of premature deaths, not to mention saving trillions of dollars in health care costs. These benefits to the public will continue to grow. Especially in tough economic times, Americans understand the real economic impact. With fewer cases of chronic asthma attacks or bronchitis, fewer children and adults have to visit hospitals or doctors' offices. With a cost of health care widely agreed to be one of the central drivers of our nation's fiscal challenges, we as policymakers would consider this a good result. The economic impacts of climate change are among the many challenges we face in these times of budget uncertainty. One of the most important issues to address will be how these changes will draw on our resources. If we do not have reliable scientific information about the impact of climate change, our industries, our farmers, our states, and our municipalities will be unable to plan for the future. I know that all of my colleagues agree that certainty is good for business. The environmental laws that we're discussing in this hearing have hardly been the drag on the economy that some predicted when they were passed in the 60s and 70s. When Congress rewrote the Federal Water Pollution Control Act in what became the Clean Water Act, one of the biggest threats to our water quality was municipal wastewater. A bipartisan Congress took a very important step by including funding provisions for states and cities to help them build wastewater treatment facilities. And it's widely accepted among environmental experts across the country and noted by all of our witnesses that cleaning up our nation's waterways has been one of the great successes of the Clean Water Act. In fact, both majority witnesses make mention of economic growth in the face of environmental regulation in their testimony, using data provided by the EPA. Over the last 20 years, while emissions of the 6 principal air pollutants were reduced by an additional 41%, the nation's gross domestic product has increased by more than 64%. Additionally, GDP has risen by more than 200% since the Clean Air Act was signed more than 40 years ago. We got not only cleaner air, but entirely new technology sectors. Investment in environmental science, research, education, and assessment efforts have been key to promulgating smart, effective regulation, and good science has been critical to protecting the environment as well as human health since the 70s. Air and water pollution continue to threaten our public and economic health, and we need strong science and research programs, both at NOAA and EPA, to help us understand the problems and respond. I'm interested in hearing how Congress and this subcommittee can best develop programs that suit the needs of our federal agencies, academic institutions, and other research and development institutions, while continuing to provide the necessary information to make informed policy decisions. President Richard Nixon, who signed the Clean Air Act amendments in 1970, said, "I think that 1970 will be known as the year of the beginning, in which we really began to move on the problems of clean air and clean water and open spaces for future generations of America." Significant progress has been made, and it is now our job to build on this legacy and ensure that we will continue to improve our environmental quality while bolstering our economy. This is not science fiction, it is our history. In the U.S., a healthy environment and strong economy are not mutually exclusive. Stricter pollution limits drive us to push the envelope of scientific innovation and create new technologies, and it's proven many times over that it can simultaneously improve worker productivity, increase agricultural yield, reduce mortality and illness, and achieve other economic and public health benefits that far outweigh the cost of compliance. Thank you, Mr. Chair.
Thank you, Ms. Bonamici. If there are members who wish to submit additional opening statements, your statements will be added to the record at this point. At this time, I'd like to introduce our witnesses. Our first witness is the Honorable Kathleen Hartnett-White, Distinguished Fellow in Residence and Director for the Armstrong Center for Energy and the Environment at the Texas Public Policy Foundation. Prior to joining the Foundation, Ms. White served a 6-year term as Chairman and Commissioner of the Texas Commission on Environmental Quality, the second largest environmental regulatory agency in the world after the U.S. Environmental Protection Agency. Prior to joining that commission, she served on the Texas Water Development Board. She also served on the Texas Economic Development Commission and the Environmental Flows Study Commission. Our next witness will be Mr. Richard Trupeck, Principal Consultant and Chemist at Trinity Consultants. Mr. Trupeck has worked in the environmental industry for 30 years, first as a stack tester, measuring the amounts of air pollutants emitted from industrial smokestacks, and then as an environmental consultant to small and mid-sized businesses. Mr. Trupeck is the author of numerous articles and books on environmental issues and air quality. The final witness today is Dr. Bernard Goldstein, Professor and Dean Emeritus at the Graduate School of Public Health at the University of Pittsburgh. He's a physician, board-certified in internal medicine, hematology, and toxicology. He's also served as Assistant Administrator for EPA's Office of Research and Development from 1983 to 1985. As our witnesses should know, spoken testimony is limited to 5 minutes each, after which the members of the committee will have 5 minutes each to ask questions. I now recognize Ms. White to present her testimony.
There we go. Thank you, Chairman Harris, for the opportunity to testify on this, I think, extremely important but often neglected topic on the state of our environment at this point in time and the remarkable record. Also thank Chairman Smith, a fellow Texan, and Congressman Weber. I'm very proud to call you Congressman. We miss you in Texas right now, but I'm very proud to call you Congressman Weber. I also appreciate being called to testify as a former state regulator who for 6 years' main job was implementing federal regulations that bind the state. When you're in the state, you are close to the people, the businesses, and the real lives that these regulations affect, where the proverbial rubber meets the road. Whenever I look at it, I am again really taken by the magnitude of the environmental improvement in this country over the last 40 years, particularly over the last 20. I have a slide up from, I think, an excellent and rare book called The Almanac of Environmental Trends. This is from the 2011 edition by Stephen Hayward that I recommend highly to you as a broad assessment of environmental condition and trends across environmental media. This is a slide from that book just comparing three major social policies: the extent of the population on welfare, the crime rate, and the amount of reductions in aggregate emissions, the lower green line. You see the incredible trend there. I would say also this has data from federal sources till 2007 that you would see a sharper decline in the last 5 years. There's been very significant decline. You'd see a very slight uptake in the crime rate, and you'd see, unfortunately, a measurable increase in the welfare rolls. I'm not going to repeat what the chairman has already said in terms of the quantity of reduction in the criteria pollutants, EPA's main job, implementing national ambient air quality standards. But a look at some of these numbers is really, really amazing. If you notice, 76, the ambient levels are what are important because that's the level of emissions that actually impact people. 76% in sulfur dioxide, 82% in carbon monoxide, 90% reduction of lead, some amazing numbers. I also am, and I guess I am repeating what you previously said, but the fact that this amount of air quality improvement went on during periods of very robust economic growth, I think, is very noteworthy. I'd add to the achievement with the criteria pollutants that emissions from our tailpipes have been reduced by about 90%, while vehicle miles traveled increased 165% as a result of better engine design and fuel formulations. Right now, virtually the entire country attains at least 4 of the 6 criteria pollutants federal standard. Some urban areas still wrestle with ozone and fine particulate matter, but the trends are all positive. But as an example of improvement, in 1997, EPA listed, I believe it was 113 metropolitan areas that were non-attainment for one of the criteria pollutants. That number has now fallen to 30. I also cannot resist a Texas example. Houston, Texas, home of now the world's largest petrochemical industrial complex, with a Gulf Coast meteorology that is the perfect recipe for high ozone formation, did something nobody said it could do. And we developed, we resisted many of the controls EPA wanted us to put on. So we used cutting edge science to figure out what is exactly our problem in Houston. How does ozone form? We did very creative, targeted controls, very aggressive regulation, but that slide shows you that what happened, which no one thought, was under the then current standard, 85 part per billion. Houston attained that standard in 2009 and 2010. 2011, historic heat, historic drought, ozone levels went up again. They are already coming back down. But I think there's a wonderful story about how the state, with a really broad team effort, legislature, universities, industries, communities, figured out how to do that. I want to give just a few examples of there's not time in this oral testimony. My written testimony goes in more detail, but again, the magnitude of improvement. Lead is an amazing thing, almost eliminated, but consider the health benefit. In the 1970s, the CDC found that 88% of children between 1 and 5 years had lead blood levels that exceeded the CDC's risk limit. In 2006, that's now 1.2%. Lead as a risk to health has been virtually eliminated. Dioxins, a big family of chemical compounds which, if exposure is right and concentration is right, can be very damaging to health. According to EPA's data, down 92%. Mercury emissions in this country have been already reduced, and this is before EPA's new mercury rule is in effect, by 60 to 70%. And the CDC now finds, and this is the next slide. Whoops, I think that's I'm a little out of order. There we go. This is CDC's, based on CDC's, again, a blood survey of mercury levels in the blood of women of childbearing years. Those levels from the most recent survey that goes to 2008 are well below EPA's new standard that is 2 to 3 times stricter than the mercury standard by the World Health Organization or the U.S. Food and Drug Administration. Benzene, which is the most prevalent of the hazardous pollutants and is a known carcinogen, has been, as a national average, those are down by over 64%. In Texas, and this is the next slide, it was a big issue in our petrochemical areas. The upper line, dotted line, was a previous level, and also that is the level the state sets for when you really need to consider the health effects. Again, through an intensely monitored, air quality monitored system in that area of the Houston-Galveston area, we have taken, those are all the black lines are individual monitors. And not only is it a positive trend for the area overall, you see how far below. That is probably amounts to an average of 80 cent reduction of ambient benzene emissions. I could go on and on. I might say that, of course, EPA regulation played a major role in this. But were it not for the prosperity in our country, I think it would be impossible for this achievement. The creative technologies, the operational efficiencies that are hallmarks of the private enterprise in the free market were absolutely necessary for this. And if you compare environmental progress in developing countries, the difference is unbelievable. My testimony notes in a World Bank list of the world's worst polluted cities, in which there's almost no mention. There are about 100 cities on each list. I give you just one example. It was the list for sulfur dioxide. The highest level was in Guichang, China, assigned a level, according to that methodology, of something like 424. And Los Angeles was the last one on the list with a level at 9, 50 times difference. We are very, very fortunate to have the prosperity that enables our businesses and our consumers to absorb the cost of environmental regulation. So where are we, and what would I recommend as a path going forward? More robust science. I think we've reached a point at which what I call the harder sciences that can demonstrate actual cause, like toxicology, medical science, clinical trials, are necessary to support the path going forward. EPA has recently, if
you could just wrap it up.
I've submitted also with my testimony a paper I did on what I consider a troubling, scientifically unjustified inflation of risks that EPA now use to justify new regulation and to implausibly calculate monetized benefits. I think it's time for harder science, for more intense monitoring, physical measurement, and not models.
Thank you very much. We now hear from Mr. Peck.
Thank you, Chairman Harris, Ranking Member Bonamici, Chairman Smith, and other members of the committee for the opportunity to testify here today. I'd also like to thank you on behalf of two other groups. One is, as Chairman Harris noted, the small to mid-sized businesses that I represent. They were very excited to hear that you were having me back. They feel like they're being given a voice through me, and hopefully I'll be worthy of that voice. The other person I'm thanking you on behalf of is my wife, who will benefit from a very nice dinner this weekend because I'm missing Valentine's Day. So thank you for her. I'd like to begin by sharing a personal recollection of the state of the environment in the United States over 40 years ago. I grew up in the 60s in the far southeast side of Chicago, in the midst of the booming steel industry that provided my father with employment. The term pollution control in those days was not yet part of the lexicon. The skies in the south side and Gary glowed a bright orange at night, and a fine layer of dust that collected on my father's car each morning offered new testimony to the tons of pollutants being expelled into the air. The water was little better. As children, we were warned of the dire, potentially deadly consequences of swimming in the foul waters of the Calumet River that effectively served as an industrial sewer. Those days are long behind us, and like those of you who remember them, I am pleased to say good riddance. Thanks to a lot of hard work and the expenditure of a lot of wealth, we have done what some, back in those bad old days, assured us could not be done. We have restored the air, water, and soil of America to a condition of which we can all be proud. If this America of the 60s was analogous to the worst messy teenager's room imaginable, in the America we live in today, we find that the old pizza boxes have been tossed, the floor scrubbed, the bathroom scoured, the furniture disinfected, and there's even a little hint of lemon wafting through the air. In the America we live in today, it would take a stereotypical severe English butler carefully tracing the tops of dresser drawers with fingers clad in white cotton gloves to find a problem. And to the extent that we choose to address new environmental issues, we should recognize that the EPA, according to EPA's own data, industry, in most cases, is a minor contributor these days to emissions of pollutants of concern. We thus have a choice today, either to recognize and maintain the progress that we have made while recognizing that doing so means we can scale back our efforts to a more reasonable, appropriate level commensurate with today's reality, or to spend increasing amounts of wealth and effort for ever-diminishing returns in search of an unachievable utopian environmental purity, instead of practicing reasonable environmental stewardship in the tradition of John Muir and Theodore Roosevelt. EPA's own data chronicles the remarkable progress we have made. I have shared some of this in my written testimony. Any sober scientific examination of the data clearly demonstrates that, contrary to popular misconception, America has and will continue to make massive reductions in the amount of pollutants that we release into the air, water, and soil. I would like to point out that those reductions include reductions in nationwide greenhouse gas emissions. We are now down to 1997 levels of greenhouse gas emissions, according to the last complete EPA inventory. The implementation of renewable portfolio standards in over 30 states, coal fleet retirements, the increased use of natural gas to generate power, and UCAFE standards will ensure that this trend continues. However one feels about global warming, the fact is that America is and will continue to do exactly what those concerned about AGW want us to do. When I say we are at a crossroads, I believe that many of those that are invested in the idea that today's environmental crisis is as bad as it was 40 years ago would agree, but they view the available path somewhat differently. They would have us believe that we could only choose between two extremes. If you don't suppose every new environmental initiative and every EPA program, then, according to the prophets of doom, you therefore support a return to the bad days of unlimited, unrestrained ecological damage. Or to put it in terms of Neil Simon's famous play, The Odd Couple, they would have us believe that choosing not to be Felix Unger requires one to be Oscar Madison. There can be no middle ground. For my part, I believe there's a desirable center that lies somewhere between polluter and Puritan. Having accomplished so much, we should not abandon those hard-fought gains, but we owe it to the men and women across America who have got us to this point to determine how much more exertions we will require of them and toward what end. For it is the working men and women across America, the people I've had the privilege to serve for the last 30 years, who have got us here. They are the engineers, the plant managers, the EHS professionals who are told they must keep their facilities in compliance while keeping them profitable as well. For many American industries, doing both has been quite the trick, and a lot of sweat and toil has been expended in accomplishing these two ends. If we are going to ask them to do even more, with less and less to show for those efforts, we owe it to them, as we owe it to ourselves, to demonstrate that these efforts are necessary, not narcissism. Thank you.
Thank you very much, and we'll move on to Dr. Goldstein. Welcome back.
Thank you, Chairman Harris and Ranking Member Bonamici and members of the subcommittee. I certainly agree with my fellow witnesses that we have come a long way in almost a half a century of environmental protection, and I routinely teach that to my students. I know of no one who teaches otherwise. But it does remind me of the personal experience of being at the end of a really productive day when I should take satisfaction in all I've accomplished, but I find that I actually have more to do than when I started. Like EPA, I'm further behind for two reasons. There's unforeseen challenges, and some of the tasks are even more complex than I thought they were. And I'll enlarge on that just briefly. New scientific tools have allowed us to identify hazards affecting our health and our well-being that we cannot see or smell. But despite our progress, we have new challenges to meet. When EPA was formed, the term nanotechnology had not been invented, and the term cellular telephone would not have been understood. In my estimations, concerns about GMO food and cancer due to cell phones are largely unfounded. But I can say that only because of the science that has been developed to explore the issues. European leaders would like to have our measured response to concerns about cell phones and frankenfoods. On the other hand, nanotechnology and other emerging technologies present real issues that must be addressed in order to maximize their promise of bettering our lives and of economic benefits while minimizing risks. Improvement in many aspects of air pollution is evident, but science shows that some of the threats, notably from ozone and from particulates, are worse than we thought and more challenging to control. For both pollutants, there is ample evidence of significant adverse health effects at even lower pollutant levels and affecting more people than previously appreciated. And not just in the United States, but from studies all over the world. Just one is a recent study of a large national cohort showing a statistically significant mortality increase down to levels of fine particulates that are well below our current standard. For ozone, the change in standard from a 1-hour to an 8-hour averaging period reflects the recognition that American society was changing in a way that put more people, and particularly children, at risk. We once had geographically well-defined cities with limited rush hours leading to a late morning hour ozone peak, but traffic now extends throughout the day. Urban sprawl is a fact of our life, and day-long ozone problems do exist. More recently, studies have suggested an independent association of daily ozone levels with mortality, so that ozone is affecting not just our children, but our adults as well. Secondly, both fine particulates and ozone are not simple end-of-pipe products, but rather are transformed in air from multiple precursors coming from multiple sources. It is not surprising that each source points to another as being the major cause. We need the controlled decisions to be made on the best science, not on the best lobbying skills. Both pollutants also exemplify the challenge of significant contributions coming from multiple small point sources, which is also a major problem in relation to clean water issues, which I do not have time to go into. An example in air is the rapid increase in shale gas drilling in local areas that are already near or above ozone or fine particulate standards. The Clean Air Act requirement that EPA review the scientific basis for the national ambient air quality standards every 5 years has been highly instrumental in leading to more effective regulation. Contrary to the repeated, and I emphasize erroneous statement that the air pollution standards are routinely tightened by these reviews, most times the scientific review has led to no change in the existing standard, and at times has even led to relaxation or elimination of the standards. Revisiting standards should be the norm for all environmental regulation. Global climate change is clearly a major challenge. It's occurring. EPA received its first funding to look at this issue from President Reagan in 1984 when I was at EPA as President Reagan's appointee in charge of research and development. It was clearly predicted then by the National Academy of Sciences that a rise in global carbon dioxide would make the Earth warmer and set in motion a variety of planetary climate changes of potentially major consequences to us. This prediction has been more than amply borne out by the temperature records, and there's no need to go through the fact that last year was the hottest year on record, or 9 out of the last 10 years have been the top 10 in the U.S. Temperature. Among the overall scientific community, only a relatively tiny handful of climate change deniers exist, and those few, as well as those who give them undeserved credence, need to at least wonder, as they compulsively quibble about the extent to which they bear responsibility for the consequences to the American public of our delay. The threshold for action should not be the overwhelming evidence that is already in place. The threshold should be sufficient evidence to take out an insurance policy to protect the American public. We passed that threshold a long time ago. Finally, I'd like to talk about sustainability. I chaired a National Academy of Science National Research Council committee. We began by recognizing that the increasingly complex challenges of today require us to make effective trade-offs among the environment, with economy, and with health and social issues. We learn much about the actions that are already taking place, and we've developed a framework which I have here and be willing to hand out, and it's part of my written testimony, that we believe will lead to improving our ability to meet these increasingly complex challenges across all of the environmental areas. The goal asked for by the U.S. Environmental Protection Agency, by today's Environmental Protection Agency, is to be able to maximize benefit while minimizing risk. We have to be able to give the tools to EPA to cut across all these various things, working with other agencies to make this happen. Finally, we can today either be optimistic about how far we have gone or pessimistic about the challenges of the future. Optimism or pessimism is classically defined in terms of whether we see the glass as half full or half empty. For a sustainable future, where we are now requires us that we must consider the glass to be twice the size it needs to be. We must be able to give EPA and other of our federal agencies the ability to right-size that glass so that we can move forward in the future and be able to respond to all of the challenges we are addressing now and will meet in the future. Thank you.
Thank you very much, and I want to thank all the witnesses for testifying. We're going to start the questioning, and I will start the round of questioning with myself. I'll recognize myself for 5 minutes for questions. And again, thank you all, because I think you all addressed exactly what we need to address, which is, look, where have we gone, and whether it's what it's going to cost us to go further. You know, a recent EPA report entitled "America's Children and the Environment" found that a number of health hazards affecting children have declined, including lead concentration, tobacco smoke exposure, children living in places that don't meet national ambient air quality standards. But the report also noted, you know, concurrent with this decline, you have an increase in the rates of childhood asthma, and I know asthma was mentioned, you know, as one of the, maybe chronic asthma may have gone down, but childhood asthma has gone up despite these improvements. ADHD, autism, these have gone up. I'm not sure these have environmental causes. We have new information all the time because they are complex. But does the EPA have a credible scientific basis to claim that further regulations, and again, as we go on further with regulations, they're going to be more expensive as we go on. We've kind of done all the things that don't cost very much. To claim that further regulations will reduce asthma, which has been claimed all along for all the regulations that were put in place. So despite the regulations we put in place, asthma has increased. When the record shows that, again, childhood asthma is increasing despite what we've done, do we really have the data, the scientific data, as Dr. And I'll ask you first, Dr. Goldstein, as you suggest, we need rigorous scientific data. We may know associations that, as you know and I know, associations are not causes, they're associations. Do we have the data on childhood asthma?
I think we do. Let me go back to a study that we did in New Jersey.
Let me just ask you then, if you think we have it, why has it gone up despite improvement in air quality?
Well, again, the study we did in New Jersey, we were able to clearly identify that ozone was associated with emergency room admissions for asthma and explained 8% of the variability. So if you're dealing with 8% of the variability, 92% is due to other things. You can cut that in half, and so many other things are happening with asthma, including changes in our diagnostic criteria, whatnot. You're not going to see that in these big, broader trends. But you will have, as we have, clear evidence that ozone is associated with childhood asthma, particularly during the summertime months when it is increased. So 8% of total asthma is important and is a public health hazard that should be dealt with.
But as we have improved ozone, why hasn't childhood asthma gotten better?
Well, again, sir, if you went from 8% to 4%, you change your from 100% to 96% in something that isn't very stable, that's going up and down because of physicians' change in diagnosis, change in treatment pattern. I don't think that's a fair comparison.
Oh, okay. Ms. White?
I'm not a scientist or a public health scientist, but I have learned that there are a number of studies which
Can you put your microphone on, please?
There are a number of studies which confound the association that Dr. Goldstein speaks about indeed that show higher emergency room visits for asthma in the winter than the summer, when ozone levels are drastically lower.
Sure. And again, it's clearly a very complicated thing. And you know, the problem is that we have testimony coming in that says we're going to save, these hundreds of billions of dollars on childhood asthma, when in fact, I don't think there's very good evidence that we know what the real causes are, the complex interactions, and it seems we're going to spend a lot of money when we don't have hard evidence. Now, Dr. Goldstein, you previously served as the head of EPA's Office of Research and Development, served for a number of years on the Independent Science Advisory Board. In your testimony, you even mentioned the American Cancer Society cohort studies that have provided the basis for nearly all the Clean Air Act regulations in the last few years. Do you agree with the principle that the EPA should not be basing major regulatory decisions on science or data that is not publicly available? Or phrased another way, shouldn't the EPA be making all this data publicly available if they're going to base major regulatory actions?
Depends what you mean by publicly available. Certainly the peer-reviewed literature should be available and should be shown. If you're talking about the raw data?
Well, we've had issues about peer review here in front of the committee. So, you know, peer review is the eyes of the beholder who a peer is. I know I've been peer reviewers, as you have been. Do you think it's not unreasonable to say if a major regulatory action is promulgated that we should have the raw access to the raw data?
Sir, I would...
Most of these studies are publicly funded, so federally funded, so I'm not sure what the reticence would be.
I would strongly oppose having the requirement that raw data on something that is peer-reviewed be...
my time is limited. Ms. White?
I think, of course, it should, because of all kinds of reasons to look at it, because of the extent to which the EPA's use of that data in the study to found regulatory decision of national consequence, and they rely very heavily on those two main cohorts, Pope and Lawden, and actually dismiss toxicological studies that show a very different outcome.
Sure. I imagine just as the FDA requires, you know, seeing the actual data. Mr. Trupeck, should the EPA release the data or make it publicly available?
From my perspective, yes, of course, especially since my clients are required to be as transparent as humanly possible. I think, at a minimum, the EPA should be required to be the same.
And most of your clients, I take it, aren't federally funded.
That is correct.
Okay, whereas the studies are. Thank you. Ms. Bonamici, you're recognized for 5 minutes for questions.
Thank you very much, Mr. Chairman. Thank you all for your testimony. Dr. Goldstein, in your testimony you mentioned, and I quote, the consequences to the American public of our delay in addressing the important issue of climate change. And you stated, but the threshold for action should not be the overwhelming evidence that's already in place. The threshold should be sufficient evidence to take out an insurance policy to protect the American public, a threshold level that we passed a long time ago. And you go on to discuss the 3 levels of prevention: primary, to cut back on the causes of greenhouse gas emissions; secondary, to prepare to mitigate the consequences when they occur. And then you added that we want to avoid the tertiary prevention, such as paying billions of dollars to help clean up after extreme storms. So we've heard a lot about cost-benefit analysis in this hearing. So will you please discuss and expand on why it's important to consider the costs of all 3 levels of prevention you mentioned in your testimony when weighing the costs and benefits of environmental regulation?
Thank you. What I've said about an insurance policy is basically what Mayor Bloomberg said after Hurricane Sandy, and what the insurance industry has been saying for quite some time. The insurance industry is now requiring people to consider, as they give out insurance, to consider potential issues related to greenhouse gas. There's no question that it's occurring, and there's no question that we need to look at it. Primary prevention is always the best. We've lots of economic figures. I've always been amused by the fact that they usually come out with a 16-to-1 ratio, which is equivalent to an ounce of prevention is worth a pound of cure. We need to be able to prevent, and we need to be able to prevent by basically cutting down on greenhouse gas emissions in a way that's cost effective. We can do it, we should be doing it, but we need to really push hard to make it happen, and Congress needs to be involved. Secondly, we need to improve the resilience of our communities. We need to be able to be responsive to these issues. I chair a piece of the BP settlement, which at the request of the BP lawyers and the plaintiffs' lawyers, that's providing, it's the Gulf Region Health Outreach Program, which is aimed at improving resilience on the assumption that there's going to be another major disaster in there, and the community and the physicians and everyone else should know better to be able to deal with this. These are the kind of efforts that we need, but we shouldn't have to wait for a major disaster to cause litigation to fund it. We need to be able to build resilience now so that people can respond.
Thank you very much. Mr. Trupeck and Mrs. White, you both have been on the regulatory side of environmental issues for a long time, and you both suggest in your testimony that the regulations that EPA is currently pursuing are onerous, not shown to yield many benefits. And both of you assert in one form or another that the EPA may be exaggerating some of the health benefits and basically incorrectly evaluating the value of statistical life and health benefits. So I wonder if you could consider the high cost of health care in this country and the impact that that has on our deficit, won't the cost of reducing air and water pollution yield savings to the healthcare sector and save this country money?
I'd be happy to initially respond. If you conclude, as I do, after an attempt to really scour how EPA builds their cost-benefit analyses, if you believe that they are imputing health risks at levels so low, way below the national ambient air quality standards, that there are probably not any measurable health benefits, then the costs is not justified. And I give you an example from the Mercury rule, the utility MACT, as it's often known. EPA has acknowledged that it's probably the most expensive rule, single rule that they've adopted to date. Something like, I believe, at adoption, at proposal, they said it would be $11 billion in compliance costs, and at adoption, I think they took that down to 10.6 or something like that. When you look in the Federal Register, not interpretation, but you look at the numbers, where they get very technical, EPA acknowledges that 0.004% of what they calculated benefit come from reduction of mercury. And the others, all the other, which is what, 99 plus, come from coincidental benefits from reducing fine particulate matter. Then I don't see how what EPA calls the most expensive rule to date, which the National Electric Reliability Commission and others have said has most risk of electric reliability across the country because of the rule may lead to a rapid closure of a significant part of the older coal-fired power plants. Then to me, the costs far outweigh the benefits.
And I'm afraid my time has expired, so if I could ask Mr. Tupeck to respond perhaps in writing? Or
We'll probably have a second round
Thank
of
you.
questions.
Thank you, Mr. Chair.
Thank you. I now recognize the gentleman from Utah, Mr. Stewart, the Vice Chairman.
Thank you, Mr. Chairman. Thank you for taking the time to be with us today, Mr. Tupeck. I'm envious that you'll get off your Valentine's with only a simple dinner. I'm afraid mine will be much more expensive than that. You know, I'm a former Air Force pilot. I'd like to come at this at a 30,000-foot level if we could. I actually would love to talk to you about the relationship between state and federal regulators. That was my original intent here. But I would like to follow up on Ms. Bonamici's question and reattack this if we could, again, from a very broad perspective. I think most of us recognize that in a perfect world, we would be able to live without any environmental impacts at all, that we wouldn't contribute to those, that we wouldn't have any negative impacts. But of course, the real world, that's not the case. There's a trade-off between our economic vitality, between our way of life that we have come to expect and the great benefits of that, and the environmental impacts of that. So the question I have, and of course the great challenge that we have, is balancing these trade-offs between the economic and the environmental impacts. And I would like to ask you again, in a big picture sort of way, do you think we do a very good job at that, measuring the true economic impacts? We talked about, you know, Dr. Goldstein, you talked about, you know, the insurance. So if you have a $100,000 house, but it costs you $150,000 to insure that house, you know, what is the true benefit of doing that? So do you think we do a good job of looking at the economic impacts? Has it become overly politicized? And ultimately, how can we do better at that? And Ms. White, could we start with you then?
I don't think we do a very good job of that, and it's difficult to do. I think just specifically in estimating costs, there should be a broader number of variables other than just compliance costs. But even more, I think we do a poor job of evaluating the benefits, because ultimately, when EPA promulgates a regulation, they are making a decision about unacceptable risk, which has so many different parts of it. Science, of course, is primary, but science cannot give you a transparent point at which risk is acceptable. That, to me, is really a policy decision. And I think when Congress made those decisions, there's parts of the Clean Air Act that are very specific. And that's, I think, how we got lead virtually eliminated, the incredible success of the acid rain program. That was when there were more prescriptive terms in the statute that bound EPA. That was the result of probably very heated debates by our elected representatives, but they set implicitly or explicitly that risk level. And I think that's very, very important as, in my judgment, the regulations that EPA is promulgating over the last 4 years have a measurably higher cost.
Okay. Mr. Tupac.
I think there are two things. One, all of the costs, benefits that the EPA claims are spreadsheet costs. They're theoretical costs. Nobody can put a witness in front of you who says my life was saved because I had 1 less microgram per meter of fine particulate ingested in my body. It's all on paper. The other thing is none of these cost-benefit analysis factors in lost opportunity costs. There are great swaths of our industrial sector that have virtually disappeared from this country, not solely because of the EPA regulations, but in large part because of them. We sell, for example, state-of-the-art, cleanest, most efficient coal boilers in the world to China, but we don't build them here. We don't install them here. We don't have that industry burgeoning here, which makes no sense, neither for the environment or the economy. And there's many, many examples of that kind.
Yes, sir.
Well, looking at it as a non-economist, I look at this from the point of view of what kind of numbers are coming that are believable and not believable. So what we've got is a number of 230,000 over 30 years that is pointed out by Ms. White as being something that she doesn't believe. She feels it's an overestimate of what the fine particulates is responsible for deaths, 230,000 over 30 years. Ms. White has told you that benzene is a major problem. I've published over 100 papers on benzene. Yes, I like to hear that. But Ms. White, using the same methodology, EPA has looked under Section whatever of the Clean Air Act is required to do cost-benefit, did the same methodology for cost-benefit on benzene, looked specifically at the Houston area because of all the great things that have been done there, to how many lives had been saved over that 30-year period. We've heard from Mr. Trupeck that EPA likes to exaggerate. So what number did they come up with? They came up with three lives over 30 years using the same methodology, going through the same science advisory board that basically beats the hell out of them each time about, are you doing this right? And they came up with 3. So, frankly, they're not exaggerating. They can't possibly have come up with 3 for them, and for Houston, for 230,000, probably work out to 3,000 lives would be their estimate for there. You've got a 1,000-fold difference, and yet you're saying that we ought to focus on benzene, which I'd like to see, but we'd want to focus on benzene rather than on fine particles. Makes no sense at all.
Doctor, if I could just very quickly in 5 seconds, I'm assuming from your answer that you believe that they do a good job of evaluating those economic impacts.
I do believe, I don't believe the number 230,000. I don't know whether to believe it or not, but I do believe that it's a lot bigger than the benzene number, and I do believe that one cannot accuse EPA of routinely overestimating if it says that for a 30-year period, or equivalent to a 30-year period, for the entire Houston-Galveston area, 3 lives were saved from its benzene actions, when that's using exactly the same methodology that it's used for fine particles.
And Mr. Chairman, I yield back. Thank you.
Thank you very much. And now recognize my colleague from Maryland, Ms. Edwards.
Thank you, Mr. Chairman, and to the ranking member, and also thank you to our witnesses. You know, I said I read all of your testimony, and I will just say for the record, I'm a proud member of the Sierra Club. I was on the board of the League of Conservation Voters, both in Maryland and nationally. I love the work of the National Resources Defense Council, work with the Chesapeake Bay Foundation, care deeply and passionately about my environment, and not because I'm a prophet of doom, not because I'm a socialist, not because I'm an alarmist or an extremist, not because I shriek, not because I'm an eco-radical or a hysterical enviro type, and not because I'm part of a green tyranny. And so I would hope that we could actually have a conversation about the environment and the importance of the government's role in regulating our environment for our clean air and our clean water, because people like me who have been advocates for our environment come from it because we're concerned citizens in our community. I look at the work that I've done over the years living in a metropolitan Washington area that's not anywhere near my colleagues' Peaks district on the Eastern Shore, and yet I care deeply about protecting our Chesapeake Bay from stormwater runoff that's created here in the metropolitan area because we have such huge impacts. Now, that doesn't impact my community, but it does impact my state, where hundreds of thousands of jobs are at risk, where our bay could have been dead had it not been for the great work of the Environmental Protection Agency and our state in making sure that we preserve and protect our bay, and where billions of dollars of commercial interests are at stake if we don't protect that bay for jobs and our overall economy. And so I hope we can get away from the name calling and really focus truly on what it's going to take from all of us in business and industry, in the private sector, in our federal and state governments and our local communities to preserve and protect our environment, to clean our air and our water. When I was a young working mother, I caught a bus on the side of a road, a highway. And every day I would stand there with my son in a stroller while the emissions were pouring out of every single vehicle going across those highways. So do I think it's a great idea that those emissions are now regulated, that our air is getting cleaner? It's not quite there yet. Do I think it's a good idea that we've made investments in clean fuel transportation so that people like me, young moms standing on the side of the road to catch a bus, aren't they and their children breathing in that air? Absolutely I do. And the role of the federal government is to make sure that it protects citizens like me. And so with that, I want to ask Mr. Truepeck a couple of questions. In your testimony, you stated that the environmental industry agree that we're at a crossroads, but that solutions operate at two extremes. You state further that if you don't support new environmental initiatives in every EPA program, then you therefore support a return to the bad old days of unlimited, unrestrained ecological damage. What exactly is the other extreme of that argument that you posit, and have you heard such an argument ever presented in this committee or this Congress?
By this committee and this Congress, no. And I believe I qualified that statement that there are certain environmental extremists who are invested in this kind of culture of doom, and that is the message that I hear from that end of the spectrum.
And so who are those people exactly?
Who are those people?
Yeah.
I hear that from environmental activist groups. I've heard that from Sierra Club members. I've had that debate with the Illinois chapter of the Sierra Club. I've heard that from NRDC and others. Well,
as I said, I mean, I'm a member of one of those groups, and I'm neither an extremist or an alarmist, but I am concerned about our environment. Also, in your testimony, as you've said, you've provided a fair amount of criticism to the Sierra Club, the NRDC, researchers, academia, and industry. Quote, you've said that the relevance depends on them discovering, quantifying, and publicizing sources of risk. Do you think that they're making it up?
I think they're vastly exaggerating it. We live in a world of risk. There is risk associated with the emissions from our own breath. You can find a few parts per billion, the pollutants that people would say that's a carcinogen in your own breath. I think it's the magnitude of risk that is routinely exaggerated.
Well, I mean, what you've just described is actually way more extreme than I've ever heard in any of my Sierra Club meetings. You've also stated that it's the advantage of some commercial sectors to create a climate of fear. What do you mean by that?
I mean that there are people, and you'll see the commercials, like for instance, the example I gave of a indoor air purifier that uses ozone to purify the indoor air, the very pollutant that Dr. Goldstein and others have said we need to protect ourselves from. But people sell those kind of products taking advantage of that kind of climate of fear, that your air is bad inside, so you need this product.
And so I know my time has expired, and can you just tell me your scientific background and your scientific research background that qualifies you to make those statements?
I'm a chemist. I don't have a scientific research background. And my experience has wholly been in the field of air quality for the past 30 years. I've participated in EPA committees. I've taught a number of classes at different universities and for different organizations.
And for the record, you've also challenged climate science as pseudoscience, but you haven't done any climate science research, right?
I haven't done any climate science
Great.
research.
Thank you.
Thank you very much. Now recognize Mr. Weber for 5 minutes.
Thank you, Mr. Chairman. Kathleen, good to see you. Quick question for each three of you. Is it possible to have too much clean air or clean water?
That's often said. Why do we worry about regulation? Because it can't be clean enough. In a perfect world, if we were not constrained by space, time, and resources, that would be true. But I find human life is, and my father used to say, nobody gets out of this alive, is fraught with dangers and all kinds of risks that we make all kinds of decisions about. I think when, again, what I call the most robust sciences that can really demonstrate causation, the impact of a certain pollutant level on the way the lungs and heart work, when that's absent from the manner in which EPA sets regulatory limits or calculates benefits. And I'll give you an example. And we've talked on and off, and we've been answered questions about fine particulate matter. EPA gets to this number of 230,000, if that was the number, Dr. Goldstein, lives at risk of early deaths, the phrase they use, by going way below the National Ambient Air Quality Standards. By law, the Clean Air Act requires those are set to protect public health with a margin of safety regardless of benefit. Very conservative standards as they're stipulated in federal law. EPA finds risk way below that in these epidemiological studies that show a correlation between a change in death rate and a fine particulate level, way below that lowest measure of the study down to zero. And when they did that, that's what statisticians call extrapolation. You go from where you have data, and you assume, well, if I have it here, I bet that goes to the unknown. That increased the number of so-called early deaths from 88,000 fourfold to 320,000. That, I do not think, justifies regulation that impacts the whole economy.
So, Mr. Trupeck, I'll get you to weigh in on it. Let me ask the question this way. It's probably not possible to have too much clean air and too much clean water, but it is possible to have too much or too many regulations which negatively impact our productivity in such a way that the benefits are far outweighed by the cost. Would you agree with that?
I would. At some point, you hit a point of diminishing returns. Since we're talking fine particulate, I will highlight the recent Boiler Act regs that were finalized by EPA, which affect industrial boilers. Fine particulate reduction of attributable to Boiler Act is 0.3% of all the fine particulate. Yet we hear what a massive benefit this would be. Well, if that's true, the majority of fine particulate in the air, according to EPA's own data, the vast majority comes from what they call miscellaneous sources. Those are non-transportation, non-industrial sources. Those are natural sources and consumer products and everything else. Well, if that 0.3% reduction is really as incredibly worth it as EPA says, we should go after that 96+% from natural and other sources. And obviously, we are not going to do that. That makes no sense. We've gotten all of the low-hanging fruit, and there's very little point for going for those things that have such a monumentally small benefit.
Thank you, and I'll ask you the same, Dr. Goldstein.
I think Ms. White basically has given the answer. 88,000 deaths above the threshold is a very major public health problem. We have to meet that problem. But of course, sir, there is certainly no need to get the very last molecule of benzene out of the air. We can have one molecule.
So you can't have overregulation.
Of course.
The best way to have a perfect clean air and water in the world you talked about, Kathleen, was maybe to move to the Pacific Ocean on an island. Now your quality of life may be really reduced, but you'll have perfect clean air and clean water. You know, in Texas, we've got 1,300 people a day moving there. I think they're voting with their feet. We've done a good job of cleaning up our air and water. And Kathleen White would know that firsthand. We believe that the TCEQ and our environmental regulatory agency, second largest one in the world, who was proactive. Actually, it was Trainwreck or
TNRCC.
TNRCC, we called it, Texas National Resource Conservation Commission, and then the Texas Water Quality Board before that.
Yeah.
Back in the 60s, was it, Kathleen?
In
70s?
The 60s, well, and this is a state issue, but the legislature combined our Health and Human Services agency with the water agency.
So we were environmentally friendly. What's that old country western song? I was country before country was cool. Texas was actually environmentally friendly before it was fashionable, before being green was fashionable.
We had a state Clean Air Act
You
before the
bet.
federal Clean Air
And
Act.
our economy shows that. Thank you very much. I yield back.
Thank you very much, Mr. Weber. And we have time, I think, for a second round of questions, and I will open that second round and recognize myself for 5 minutes for that. Ms. White and Mr. Trupeck, an important check or important checks on FDA science, EPA science, are independent scientific advisory panels like the agency's Science Advisory Board and the Clean Air Scientific Advisory Committee. In your view, are these bodies independent and objective? Because obviously we'd want to have independent, objective bodies, panels reviewing data before we come up with costly regulations. Are they?
Very difficult for anyone to be 100% objective. But from what I have learned on many of these panels, unfortunately, the majority, if not all on them, are sometimes derive a significant portion of their income or almost all of their income or the institute at which they work from EPA studies. And so it seems to be, in fact, I think on some of those panels, people from the state like me would love to see like state regulators and a much broader group from that, and also people from more diverse scientific disciplines, which has also been recommended by the National Academy of Science.
Okay, Mr. Trupeck?
I would agree. From my perspective, everybody has their own particular blinkers on, and I would include myself on. We all do. But in my opinion, CASAC especially is very heavily weighted on the academic, environmental advocate side, with very little checks in CASAC on that particular perspective, and I would like to see them particularly reformed.
Sure. Now, but Dr. Goldstein, you've helped to appoint and serve on these scientific advisory bodies. And, my observation in medicine is, not every good doctor is in an academic institution. Some actually are in private fields. And they bring something to the table there, and they add to the subject. So would you object to the inclusion of qualified scientists or more qualified scientists from the private sector serving on these panels, addressing Ms. White's complaint that it appears there's a little inbreeding going on?
As long as I can qualify it by saying that Ms. White is, I think, absolutely wrong by saying that the EPA is funding most of these scientists, if the majority of the funding comes from EPA. I think the head of research and development at EPA would love to have the kind of funding that would allow them to give the majority to CASAC members. In fact, CASAC's members are folks who are funded to a large extent by to the extent they're academic, by the National Institutes of Health and others. I will tell you that CASAC, at least when I chaired it, had a requirement from Congress that it have at least one of its 7 members be a state official involved with air pollution and another be a physician.
What about privates, particularly private sector?
I don't think there's a requirement for private sector.
Do you think
but
there ought to be?
I don't know if there should be a requirement, but we always had someone from the private sector on there, and I would strongly support that.
Let me ask you two follow-up questions to something we've heard, folks. The question was, well, are there radical environmentalists who propose some of these things? Oh, look, we had Josh Fox in this hearing room, published Gasland. Now, Dr. Goldstein, you're laughing. I'm going to ask you, have you reviewed the EPA findings on Pavilion and Parker County and Dimmock and all the rest? I mean, where they come back and say, basically, there's no scientific basis for saying what we've said, walking it back. Do you think there's a sound scientific basis for their initial findings at Pavilion? I don't know. You may not have read the report, and it may not be a fair question. Have you read the report?
Not the final report.
Okay, because it has a lot of benzene mentioned in it, actually. But when we talk about the huge costs of going to the next step in some of the Clean Air Act requirements and regulations. You know, the $10 billion cost mentioned, you know, for the mercury rule. You know, the opportunity costs that Mr. Trupeck mentions are true because, you know, if we take those $10 billion, instead of investing it in that, we invest it in research to address, you know, why childhood asthma, you know, what are those other 96% or 94%? I mean, what is the real cause? It's very complicated. I mean, we could boost the NIH research budget, you know, 20-fold probably for asthma, or maybe 40-fold, I don't know. There is an opportunity cost loss when we decide that we're going to go down one pathway to regulate and spend and not use that money to perhaps more carefully define a complex scientific basis for solving our air and water quality. What do you think, Dr. Goldstein?
Well, I agree with you up to the point of saying that, first of all, from the 1960s, since I've been involved in it, I've heard over and over again these same arguments, and then industry retreats from them, as it turns out that, in fact, they can do it at far less cost. And second of all, I've yet to see an example where Congress has moved money from one separate branch that's controlled by one committee to another branch. I've yet to see the kind of thing happen that you've described. So that while you may be right,
very valid argument, Doc. Very valid. I recognize Ms. Bonamici.
Thank you very much, Mr. Chairman. We had a lot of discussion about the role of industry in developing innovative technologies to reduce emissions. And I know, Ms. White, in your testimony, you talked about prosperity and the importance of prosperity and how Los Angeles did a better job than China. I just want to suggest that perhaps that's because we do have strong environmental laws and regulations that motivate that innovation. I wanted to ask Dr. Goldstein to follow up a little bit about lead, because Ms. White said a couple of times that lead has been virtually eliminated, and I wanted you to discuss the studies about that, and also, isn't there still work to be done?
Well, yeah, virtually eliminated is simply too strong a term, I think, for what happens still in communities that have a lot of lead burden in their homes. Again, as a teacher, when I teach about environmental justice, I usually make the point that if something that was affecting the IQ of America's children was built into, say, suburban housing post-war, say the Formica tops to tables, we would have gotten all that out by now. We haven't done that with the lead yet, and we still have homes with lots of leads. We still have kids who are affected. We have, I put in my testimony, HUD's cost-benefit analysis of the tremendous value of taking the lead out of childhood homes. We simply haven't done it yet. So to say it's virtually eliminated, that's true for me, but it's not true for important segments of our population.
And just to follow up, how much certainty was there in the science about reducing lead in the 70s when the studies began?
Well, in the 70s and the 80s, people have forgotten that the Reagan administration took the last lead out. It was based on a cost-benefit analysis that OMB bought, and that it was costing more to have lead in than before. And that's at a time that CDC did not have as stringent a requirement as it has now based upon the new data. So that the lead issue, we were late on that, as we've been late on a lot of these issues that we recognize now were causing significant adverse effects, as I think, as I've testified, that we're late on the global climate issues as well.
Thank you. And I yield back, Mr. Chair.
Thank you very much. I recognize the gentleman from Texas, Mr. Smith.
Thank you, Mr. Chairman. Mr. Chairman, when you gave your opening statement, I liked your turn of phrase, the greatest story never told. And, of course, you were referring to a number of ways in which the United States environmental metrics have been going the right direction. We still need to do better in a lot of areas, but there's a lot of good news out there, and sometimes that good news is ignored. Ms. White, I guess I could say Director White or Commissioner White, I wanted to address my first question to you. And you went into more detail in your written statement, and I think you mentioned water quality briefly in your oral statement. But I'd like to go back and ask you if you feel that our water quality is important and how you can quantify that.
And that's a difficult question. I think there is, I think that there's far better federal data on trends in air quality than there is in water quality. And for somewhat understandable reasons, I don't know what the extent of the how many hundreds of thousands of miles of every stream, small stream, and then big river. But I can't. There are a couple markers, I think, which again underlines a positive trend, a job not over, a regulatory job not over, but very positive trends. We regulate public drinking water systems for, I think it's over 100 different contaminants, which is a good thing. We have very, very safe. And I believe, as far as the last data I saw from EPA, 94% of all the public water systems in this country have perfect compliance with all the standards.
Now, how does that compare, say, to 5 years ago or 10 years ago?
I think it was 10 years ago, I think it was something like 70-some were in fully compliant. So there's been a 20%.
Can you get me the data on that?
I'd be happy to,
compare
sir.
today's 94% compliance with, say, 5 years ago, 10 years ago, whatever it might be. Again, I like the trend, which is encouraging. Okay, thank you. Mr. Trupeck, wanted to ask you about air quality. You mentioned that has been improved. The EPA actually says there's been great progress, although they say almost half the American people live in counties where there is an unacceptable level of air pollution. I wonder if this is a situation where both statements are accurate, or if you challenge the data that the EPA is using.
Well, that statement is possible only because of a redefinition of the term clean air. Over the last 40 years, there's been 18 instances where the EPA has looked at National Ambient Air Quality Standards. In 10 of those, they have either reduced the standard or added additional standards that effectively did the same thing. So when you say you have all of these counties where people are living with unhealthy air, it requires that continually redefinition to make that happen.
Okay, thank you. And Mr. Goldstein, you mentioned, and we've heard about it many times recently, including in the State of the Union address by the President, that several of the last few years are the warmest on record. Also, of course, if you look at the last 15 years or so, you see that the temperature has flatlined and has not gone up during that time, despite predictions that it was going to do so. But my question to you is this, and I don't know the answer myself. I've asked it to a number of people and gotten a number of different answers. This goes to global warming. And to what factors do you attribute global warming? And if you can break it down as a percentage, that would be great too. You have human activity. You may have the influence of solar activity. You may have the influence or the historical cycles of temperature going up and down. And, of course, when we say it's the warmest on record, it depends on how far back you're going in the record, too, because it's been warmer before as well. But to what do you attribute global warming? Can you break it down and quantify, or not break it down, but give me what percentage is attributable to human, maybe solar, maybe cyclical, or is it even possible to get to an answer?
Everything I read gives the overwhelming amount to humans. We've had, I think in the last, if you look at the temperature records in the United States from, I guess we're well over 150 years now, we've got the 10 highest of those 150, 9 of them are in the past decade, and the other one was in the 1990s. But something's happening.
That's true, but as Mr. Trupeck just pointed out, if you change the standards or the methodology, you might end up with different results than you would have otherwise. But let me go back to my question again. Can you break down, I mean, you say you feel that most of it is attributable to human activity. Is it 51%? Is it 91%? Does anybody know?
Sir, I'm not sure. I do know that to the extent that it is due, if it is due at all, to a natural cycle involving the sun, we can't do anything about that. To the extent that it is due to human activity, and it's a very large extent, then we can do something about that part. And so whether it's 83% or 72% or,
well, is the human contribution from the United States, everything I've read is it's below 1%, it may even be below 0.5%. Is that generally accurate?
No, I don't think so at all, sir.
Okay, what part of it would
I would. Sorry, I would not. I'm not an expert on that, but
so we don't know how much people in the United States contribute to global warming?
Well, by we, if you're asking me individually, if I can tell you right now, the answer is I can't. But if I could go and look at the literature and look at what the various groups that have looked at this from, as I say, during President Reagan's day, the National Academy of Sciences in 1984, we can give you what's the range of predictions.
I've read it's below 1%, but I'll wait to see if you feel differently. But I
would be happy to send that.
Your answer is you don't know for right now.
I'm willing to bet it's not 1%, and I'd be happy to review it and send you the materials, sir.
Okay, thank you. Thank you, Mr. Chairman.
Thank you very much. I recognize Mr. Stewart from Utah.
Thank you, Mr. Chairman. Once again, I'd like to maybe shift gears just a little bit of focus and bring in some examples and then maybe a question from that. I've worked for many years in the energy sector in environmental consulting, energy development. I think most of us would agree is a wonderful thing for us on many levels. It has the potential to revolutionize our world both economically and from a national security perspective as well. In recent years, EPA has taken a fairly aggressive approach to some of the technologies that have allowed us to take advantage of some of our resources and has initiated lawsuits that were quite troubling to many people in some of the accusations made in these in their environmental impacts. And then, of course, in virtually all of these cases with fracking, the courts have not sided with the EPA and have decided that that the science that they had based that on was not reliable. Another example of the point of my question is Ms. Jackson has been quoted, and of course this was created a lot of emotion for people. And talking about some of the pollutants and the best advice, she said the best advice I can give you is don't go outside, don't breathe the air, it might kill you. These types of actions or public statements, again, people look to these people as leaders. They look to them as affecting public policy, and they take seriously what they say. And I would ask you, do you think it harms public policy? Do you think it harms our confidence in these leaders, these environmental leadership, when they take actions or when they make statements like this that create fear and concern in the public and yet prove not to be true?
I say this from the perspective as a former chief of the state's large environmental agency. I think a fundamental responsibility in that job is to meaningfully, accurately communicate to the public and not to use, a kind of rhetoric that invokes nothing but fear. And, we may critically disagree about the degree of pollution or its impact on health and all of that, but I don't think, to say it more appropriately, you rarely ever hear senior EPA officials try to communicate to the public the extent of the progress we have made. And again, not that we're finished with it, not that regulation does not play a role, but I think it's like, I give you the example of mercury, which is, I think, of great concern to women who are having children or have young children, because they are the most vulnerable. And when you have it, again, it doesn't mean caution. It's an area where I would use the precautionary principle, of course. But when you have now, like the Center for Disease Control study that show that in a national blood survey, again, they're never perfect, but a national blood survey, that the average levels are way below what is even the EPA's extremely strict standard. Those kind of things should be communicated to the public.
Dr. Goldstein, understanding that there's some disagreement among the witnesses, and we respect that, and perhaps some of us here, when you hear these types of statements or when you see these types of actions initiated through the courts, which are not borne out, does that make you cringe a little bit? Do you think it hurts the advocacy, or what's your reaction to that?
No question, we need to be based upon the best science, and there's no question that there are bureaucratic things that are inappropriate. I can sit down over a drink and we can compare the U.S. EPA with my university as to which have most bureaucratic inefficiencies built into it. Yeah. So I don't doubt that you can reason by anecdote on these.
You're going to have to buy a lot of drink to get through that conversation.
I've been at a lot of universities. But, the issue of the EPA's aggressive approach on fracking, From where I sit in southwestern Pennsylvania, I don't see any slowdown whatsoever based on anything that the U.S. Environmental Protection Agency's done. So in terms of getting things right, I do not see the slightest bit of impact of the U.S. Environmental Protection Agency on how people are going about in fracking, except they're concerned that if they do it wrong, they're going to cause regulation to occur.
Yeah, exactly. I agree with you. And the concern wasn't the impacts, because it turned out there wasn't reason to slow that. My biggest concern was the public perception and the public concern and fear that was created by some of their statements and some of the accusations that they had made.
Sir, we recently have a paper accepted for publication where we looked at what people were complaining of who believe that they've been adversely affected. That's not an unbiased sample, but what are they complaining of, and what is stressing them the most? And 5, 10, 20% are saying they're being stressed by the noise, by seeing the trucks or whatnot. About 60, 80%, I don't remember the exact numbers, are saying they're being stressed by the fact that they think industry is lying to them. They think that things are being kept secret from them by industry. So we've got a situation in which, and I can tell you that the chemical industry folks that I speak to say that they think that the drilling industry and how they've gone about this, they're aghast at how poorly they've handled this. So what I see are people who believe that there's a problem because of what industry and state government is telling them, not because of what the federal government is saying.
Mr. Chairman.
Thank you very much. Recognize Mr. Weber.
I'm going to follow up on what Mr. Stewart said, Dr. Goldstein, and I know that Kathleen Hartnett-White will remember this, and you may too. There was a Region 6 EPA administrator who made the statement that in dealing with industry, you do like the Romans do when they invaded a country. You crucify the first 5, and then the rest of them will fall in line. Do you think that hurts the credibility? Do you think that adds to the public's perception that something's very, very bad wrong in this country? Do you think that furthers EPA's, if you will, mandate? I hate to use that word.
No, sir, I do not.
Okay. All right. Well, I'm glad to get you on record as saying that. Let me go back to my earlier comments about it's not possible to have too much clean air and clean water, but we can overregulate and we can negatively impact our quality of life. You know, we've got a study, for example, that shows the difference. In China, it's no news to anybody that they're growing leaps and bounds, and they're manufacturing coal facilities. I think Mr. Trupek said we manufacture that clean air technology over here, but then we export it to China. And China has on the drawing board over 500,000 megawatts of coal generation in the coming years. And of course, you can take that over to India, which has also over 500,000 megawatts. You drop back to the United States, which has only 20,000. Do you really believe, Dr. Goldstein, that if we negatively impact our industry and we put stringent requirements on them, that those countries abroad are going to follow suit?
I really don't know how to answer that. I don't know what's going to happen. I do know that all of the studies that have been done in countries that have gone through rapid development, for instance in Korea, show that in retrospect they would have preferred to have more environmental controls because it cost them more money. Not forget the health. It cost them more money.
Let me help you. You can answer it yes or no. Do you believe they're going to follow suit? I think we'd have to agree no, they're not going to follow suit. We're going to negatively impact our industry over in this country. Mexico is not going to follow suit. If you believe that those emissions waft over here from Mexico. I was on the Environmental Reg Committee in the state of Texas and was aghast to hear some of the rules that the EPA was promulgating. And Mr. Trupek, I'll direct this question to you. In the Texas legislature, we passed a bill that said before the TCEQ could promulgate rules on the industry that they had to do what we would call an industry impact analysis to take into account. Would you think that would be good legislation on the federal level?
I think that would be excellent legislation on the federal level, and I think Texas's success in their remarkable economic growth and while protecting the environment, it's one of the best states for people in my business to do business in.
You bet.
And I think that would be great to take to the federal level.
Thank you, and I'll direct my last question to Ms. White. The EPA took over our flex permitting. Was that last year or before last? About 2 years ago.
About 2 years ago.
Can you explain to our panel here, Ms. White?
Okay, and I'll try to do this very briefly. And this has to do with, in my testimony, what I think as far as priorities for moving forward is the importance of, as I said, more vigorous science but targeted regulation that does not go too far. Texas developed a permitting program for major air emission sources called the flexible permits, which gave the facility an emission cap for the whole facility instead of a cap on every emission point, which is EPA's traditional way of doing their major air quality permits, called prevention of significant deterioration permits. And it was stricter as a one standard, but it enabled the operator to figure out how he was going to run that, where maybe there were days he needed to ramp up.
Some fluctuation.
Yes, ramp up production. And it opened, a monitor showed most of those big industries in Houston that reduced so much emissions were under flexible permits. After 15 years, EPA had never formally approved it, but they'd never raised the problem.
And they were required by law to do that, weren't
And
they
they
not?
required by law. And in about 2009 or 10, I think, they decided to disapprove it. And long story short, we legally challenged that decision, and Texas prevailed. But here's the sad part of that. Many of those industries, because when EPA disapproved it, it also sent a letter to 120 of our major industries that said, you're out of compliance with the law. And, being compliance with the law mean you can't, if you're out of compliance, you can't even operate. So most of those facilities deflexed. They went back and got a version of which is actually the traditional, more shackling EPA permit, and we'll see how that works out. I might add just one last point that I think is a very interesting one. In reading all that I do about these issues, someone noted that EPA regulation, as it gets more and more complex and layers, makes business operate like a bureaucracy. We're certifying your certification of your certification instead of really trying to run your business tight and efficient so you reduce emission becomes what you have to do. And that might sound like just a general statement, but I think that's a really scary. And how you design regulation, how you target it, how you draw upon the creativity and motivation of the business owner to get the job done has, I think, greater environmental results.
Thank you. Thank you, Mr. Chairman.
Thank you, and I'm going to recognize the chairman of the full committee for a brief question.
Thank you, Mr. Chairman. Congressman Weber's questions remind me of a couple of questions I'd like to direct to Dr. Goldstein, and this goes to EPA regulations as well. Would you favor, Dr. Goldstein, the public release of the cost of regulations before they're actually implemented so the American people would know what the economic impact would be before they're actually put into effect?
Yeah, very much so.
Okay, good. And secondly, if there were a number of ways to implement a regulation, would you favor implementing it in the least costly way possible if the same goal was achieved?
Yes, of course.
Okay, good. The Judiciary Committee in the House of Representatives last year passed 2 reg relief bills to do just what I described, and they were opposed by the administration. And they seem to be common sense approaches to regulations, and so I thank you for your support of them. Thank you, Mr. Chairman.
Thank you very much. Before we close, I'm going to recognize the ranking member for a request.
Thank you very much, Mr. Chairman. It's been an interesting discussion. I'm not certain that the testimony presented presents to the full extent of what I believe we were here to discuss, the state of the environment and especially the impacts on public health of certain environmental laws. So I'll be reviewing the testimony and where appropriate maybe noting for the record where I believe clarification or additional explanation should be made. Thank you, Mr. Chair.
Thank you. And I will, reserve the right to object to inclusion of the material until my staff and I have had time and opportunity to review it. I want to thank the witnesses for their valuable testimony and the members for their questions. The members of the committee may have additional questions for you, and we'll ask you to respond to those in writing. The record will remain open for 2 weeks for additional comments and written questions from members. The witnesses are excused, and this hearing is adjourned.